Welcome. I'm Rogers Anderson, Williamson County's mayor, and as we travel around our county today, we have the opportunity to visit with Don Webb and Lori Ormes, and thanks for being with us.
Welcome.
Good to be here.
If you didn't know, both of these folks are from Williamson Medical Center, and so a lot has changed out at the medical center just in the last few months, but really over the last 15 years. Now, of course, I would be remiss if I didn't ask, how does it feel to come back to the old hospital here at the administrative complex?
Well, I was telling Lori as we walked in, every time I come over for tags or any other business over here, I'm reminded of the hospital because I worked here prior to the move to where its current location. And actually, your office was my office at one time.
So anything that goes wrong, it's your fault?
Yeah. So when I was in there with you the other day, I'm sitting there thinking, oh, I remember sitting in here. It's a long time ago, but it brings back a lot of good memories of being over here.
And so, Lori, I should know this. Did you work over here too at one time?
I did not. When I came to town, the hospital was a year old in its new location. So I've grown up with the new hospital, seen a lot of changes in those years, but heard of a lot of stories about this place, but never had the opportunity to work here.
Well, that's a good opportunity for us. Let's just start with Lori. Where did you start out? Where's home? And I know you've raised your family here, and I know you love this community. But talk to us a little bit about Lori Ormes. I know that wasn't your maiden name.
Raised in Baton Rouge, go LSU. Was in healthcare from really my grandfather and my mother were in healthcare all of their lives, so kind of grew up in that family, and actually had made rounds with my grandfather on Sundays from the time I was 3 years old. He'd bring me and sit me up at the nurses station and stuff. So raised in healthcare, went to nursing school, graduated from the old diploma school in Baton Rouge and became a nurse, and just worked in recovery room for years in Baton Rouge at Our Lady Lake Hospital, and then we moved here in 1987. Actually interviewed, the only place I interviewed was Williamson, and I've been there for the rest of my career, and again just kind of started in recovery, and it grew and grew and given more responsibility and ended up in administration. So it's been a good journey.
Has been. Don, how about you? I know you're from West Tennessee originally.
Yes, sir. I grew up around Dyersburg, Tennessee. Been in healthcare a little over 40 years, if you can believe that, and came to Williamson Medical Center in 1985. Prior to that, I worked at a hospital in Chicago for 4 or 5 years, just before that, and came here in '85 just as they were having the conversations about moving the hospital to its current location, and how difficult a journey that was for people out here. I came in on the tail end of that. Thankfully, didn't have to deal with a lot of the politics around that at the time. But it was a great place even then, but got better as we made that move to the other side of the interstate and had space and ability to grow and bring new services and expand and services like the Children's Hospital that I assume we'll talk about in a few minutes. All of those were possible once we had the additional space, and very happy with that move and what's occurred since then.
Don, in a few minutes I'm going to ask you, I'll give you a heads up, what is the relationship between Williamson Medical Center and Williamson County government? But when you two were talking, my mind, I went on the hospital board in the late 80s. And there's always one person that stands out during that middle section, became a hospital board chairman, was a county commissioner. That many people will watch this show and remember David Buchanan. David, of course, lived there on Hillsborough Road, and feisty old fella in his young days as well as old. But he was a county commissioner, and he worked hard and supported the move to go out there, and it probably ultimately cost him his electoral position. But he never wavered on the importance of the hospital moving out to a new site. Not that it was bad here, it could be better there. And of course now it's hard to believe, this being 2015, that was in 85 and 86s, somewhere along in there. That's been 20 years.
30
years. Excuse me, 30 years. How's that for math? And that's
Yes.
hard to believe.
I'm often reminded of Mr. Buchanan. He was just a great person, very supportive of the hospital, as you said, and yes, sacrificed to make the changes that he thought were necessary for the hospital. And as it turned out, I think he was correct. He was a mentor to me when I first came to Williamson, and in working with the board and working with the county and just working with other people. David was great at that. Everybody liked him, of course, but he could come in with a group of people on a difficult subject and get consensus by the time he left there.
He was truly a negotiator.
Yes.
Long before that. So what's the relationship between Williamson Medical Center and this wonderful county we live in?
Do you want the legal description, or you?
How about the lay term?
The lay term. We have a great relationship with Williamson County government. We are a private act hospital in the state of Tennessee, so there is a sort of buffer between the hospital and the county government. But that has always, to me, while I've been there, been a very good relationship. The county provides some oversight, but mostly they appoint a board. That board is charged with providing oversight, and they don't meddle in that very much. We've never had what I would call a difficult relationship with them. When we need something, the county has been very supportive, and we've had the use of the county's bond issuing authority 3 or 4 times while I've been at Williamson. And while that's sometimes had lots of conversation generated about it, at the end of the day, the county and the commission as a whole were very supportive. The county, and talking about county government, but also the city of Franklin, is very supportive of what we're trying to do. Work with us when we have a project and trying to get through the codes process and these other things that are required. The county and the city are both very supportive. Nothing negative to say about either one of them.
And Lori, as you look down the road, I know you're only 29, but in the whole scheme of things as your working career, a lot has changed. And yes, by profession you're a nurse, but in the role that I see you now today, you're much more than a nurse. You're a statistician, you're a programmer, you're a supervisor, you're you name it, you're involved, you've got your finger into it. Many things about healthcare have changed, not just the models that we talk about, whether it's affordable healthcare, which has had lots of discussion, particularly in our Republican-based county. It's always going to have it. But it's got some good things about it, whether we like to say that or not. It's brought to the table elements of coverage for our children now to the age of 25 and 26. As before a child finishes high school or college, they were that insurance. So as you look into your crystal ball, put you on the spot, how are we going to continue to develop those kind of services professionally, physician side as well as clinical side? How do we continue to develop that over the next 30 years? How's that for a question?
Yeah. It is a moving target, number one, and we're being asked to develop models that we really don't know the endpoint still yet today. We're moving from what's called fee-for-service to a much more of a holistic healthcare delivery model. So in that just kind of brings about all kind of change, because like you said, you're constantly monitoring data to make sure that the quality is there, that there's all kind of research constantly going on to see what is the best thing to do for this disease entity. So I think it is just going to be more and more data driven. The electronic medical record, that's kind of the purpose of the electronic medical record, to be able to capture that data. And then the other, probably the biggest change, which is going to be very positive, is the whole Affordable Health Care Act. The premise of that was what's called a continuum of care transition, so that we will have one record. This is years down the road, but we'll have one record that you can go to and you can see Lori Orme's record. And so if I go to the emergency room here, or if I'm in Denver skiing and I break my leg, they can get to that record. Or I have a total joint and then I go to NHC Cool Springs, for example, that they would have access to that record. So it's kind of twofold. It's monitoring all of this data and all of this just evidence-based practice, but being able to have one healthcare record it's going to come about. It's been challenging, but it'll get there.
So when you look down the future and people that are watching this show and they're thinking, can I get better health care coverage? And the answer is going to be yes.
Yes.
And better outcomes. Yes, you may have a few more lines on the forms to fill out, but it's getting better.
It's getting better, yes. Lori's touched on a couple of these things. There are lots of models that are out there currently as we transition away from fee-for-service to one of multiple models. That data is the king here. It's what drives everything, collecting data, asking people to fill out forms currently so that information stays with you. If you stay in Williamson County or if you move somewhere else, someone will have access to that information. Part of the point of that, of course, is to improve the quality, increase the quality of those services that our entity or other entities are providing, but it's also to keep the cost down so that you're not repeating tests if you go to one physician or one hospital and then you're in a different hospital the next day. If you've already had certain tests, you don't have to run them again. It's a model that is designed to try to reduce costs but improve the quality.
So Don, we've got 1,500 full-time equivalent at the hospital.
About
1,400. And I'm sure a lot of folks here do not realize that most of the physicians, which are all board certified, or not all, but the majority of our physicians are board certified. The most successful hospital realizes the importance of their physicians to the practice.
Yes, that's
And you and the board realize the hospital is nothing but bricks and mortar and a whole bunch of equipment without the physicians. So we spend a lot of time in recruiting, looking at, encouraging our physicians to be the best, the pinnacle, so that we can compete in our community with other communities. That's important for the public to realize that we do have hospital-based physicians. We pay,
Right.
just like those 1,400 approximately employees. And as you look at that hospital, it's expanded in the last 30 years of the services we offer. There's breast health care. There are so many things. Children's Hospital, which we want to dig into here in a minute. What else can we do out at our hospital to offer these services? And it's competitive. It is, and it will be competitive for years to come. You've got the big boys in Nashville. You've got evidence of them here in the South. Everyone wants a piece of the Williamson County market.
Yes, sir, that's true. So doctors are the lifeblood of the hospital. You're right. The hospital is a building, bricks and mortar, and equipment. Without those doctors, and I would also add without that nursing staff that we have, an excellent nursing staff at Williamson, we have an excellent medical staff at Williamson, and working together to provide the highest quality health care that anyone could find anywhere. And our physicians are all board certified, virtually all of them. But the nursing staff is highly trained, specialty nurses in just about every unit there. You mentioned our breast health center that opened this June. That's another specialty area, and I will tell you that breast health center is very busy. Those patients who are Williamson County residents currently can stay in Williamson County now for that care and not have to leave the county. That's very important to us. The Children's Hospital, the Children's ER was about keeping that care within the community so people felt comfortable and staying in the community and not having to go downtown for that service. And then let's go back just a minute to what things are changing. Yes, they are changing slowly. They're always changing. but some of those models that we're looking at, Lori mentioned fee for service as a payment model is
I think you're going to
becoming
have
outdated.
to qualify what fee for service is. A lot of people wouldn't understand that.
The easiest way to think of that is that if you go into the ER or you go into your physician's office and they provide a service for you, they charge you, you pay that bill, and you're finished. If tomorrow you have another occurrence, you come back, they provide the service, and you are charged for that service. One of the models that we're looking at and is Lori mentioned I think we talked about bundled payment is one of the models that's out there, so that you would come in and rather than be paid for a fee for a service we provide the service and we provide other services even if those services aren't within Williamson Medical Center. And as a package, we are paid for that. That's how they bundle that, so there's no longer a fee for service. There's also something called population health management, where within a population of people, for example, an employer wants his employees and their dependents covered for a wide range of services. Again, even things that we don't provide. Williamson Medical Center will contract with that employer to provide those services and then contract with others that provide services we don't, so that there's a one-stop for that employer. So I know if you've ever been in the hospital, if you've ever been to a doctor's office, you get home and a week later the bills start coming in and you're so confused. My 89-year-old mother just wears me out about it. And I'm as confused as she is, honestly, when I sit down at the table with her and try to go through those. So there's these sort of experiments trying to either eliminate or reduce that duplication.
I was just sitting here thinking, you reckon 30 years ago anybody even brought up the word bundled payments and fee?
No.
And you know, healthcare is really complicated for the people that have to manage it and work there and run it. But the customer, the one that comes through the door, they really don't want to be there.
Absolutely.
It's kind of like paying taxes. They really don't want to be there, but when they're there, they want to get the best they can, and they want to get out and go home and get back to a normal way of life. Now, that hasn't changed since the Burton Act back in the 50s.
That's right, and it doesn't matter how you pay for that. That's our ultimate goal, is to give people the highest quality service that we can provide and get them in and out of that situation as quickly as possible.
But one thing that some of these different models, one thing that is kind of changing is the physicians, especially the surgeons, and I grew up in the world of surgery. They were the captain of the ship. Mm-hmm. They called everything. They came to the hospital, like y'all said, bricks and mortar. One thing with all these models that is changing is collaboration. And it's always been a team approach to the delivery, you know, the nurses, respiratory therapists, pharmacy. But all these payment models are causing more and more collaboration. And the goals suddenly, there are more goals than just the healthcare. It's the cost and the outcomes, and to make sure that, you know, that's what's been wonderful about the Children's Hospital is we had for years, we did pediatric surgery. What we did not have was the pediatric medical component, the inpatient. So the collaboration with Vanderbilt, we've been able to bring some of their medical evidence-based practice down to Williamson, order sets, dosing schemes for antibiotics, just all of this kind of stuff, and deliver that medical pneumonia, asthma, those medical conditions, and been able to partner with them and bring to the county this evidence-based practice so people don't have to go downtown. But again, it's collaboration. That's what I think's changed probably in the last 10 or 15 years. Collaboration, physician engagement has really kind of changed that.
Well, I mean, you brought up the Children's Hospital, and let's just jump into it. I remember a discussion with Greg over at Bone and Joint. It's probably been 6 or 8 years now. Time gets away from me. And the Bone and Joint for many, many years was freestanding, independent,
Absolutely.
never going to change. This is the way we're going to be.
That's right.
Brought a high percentage of the volume of cases to our hospital, and still do, and still growing, but they're no longer independent.
Right.
And I remember Greg talking about someday we'll have a children's hospital, and that was intriguing to me. I know you were, well, both of you had heard that. It took forever for that collaboration to occur. But it's not like anymore. There was a time in my life, if I wanted to buy a car from a local dealership, Walker Chevrolet or Darrell Waltrip or any of the other car dealerships here in town, that you could go down, write a check or borrow the money and drive out with the car in a matter of minutes and probably sign 2 or 3 pieces of paper, and that's depending on if you financed it. Not so anymore. Everything is much more lengthy, and it's a time process. I'm not picking on the car industry. I'm just saying it takes more. Same for the hospital.
Yes.
To get that kind of impact has taken a great deal of time. Hats off to you and our chairman and the board for staying with it, the staying power, to the nursing side. What has it brought to our community, though, Don, to have Children's Hospital here from, and there's a name you have to say every time we're supposed to say, what is it, Vanderbilt?
Monroe
My
Carroll
dear.
Jr. Children's Hospital, Vanderbilt, at Williamson Medical Center.
And there's a reason for that.
There's a reason for that. Yes, there is. The Children's Hospital is the single most requested topic to discuss anywhere I go. It's been the most positive thing we have done in my memory at Williamson. At any event that I attend, at dinner, wherever I'm at, someone will say something positive, have had a positive experience at the Children's Hospital. And I think that's what we brought when we spent the time and the effort to pull together that relationship with Vanderbilt and the Monroe Carroll family, by the way, to bring that out here. People can stay in our community, be close to home, feel that their child is being well taken care of when they come to the ER or if they stay overnight. And that comfort, I think, is the big thing that we brought.
Lori, I know that you were very much involved in the not only helping to get here with your information at board meetings, but also the actual staffing of the Children's Hospital. And in the 5 minutes we've got remaining, I've got to get a few questions in here. That number one is, do we need nurses?
We
And
absolutely need nurses.
people watching this, is there still opportunity for someone to be a nurse and make a good living and support their family, either as single or as a married person? Do we really need? How does one do that?
We absolutely, the nursing shortage has hit us with a vengeance over the last 6 months. Not just Williamson Medical Center, but talking to people in Nashville. It's changed. People are older. Again, the average age of a nurse in the hospital is close to 45.
Sounds young to me.
It is young, but it used to be 22. I mean, it's when I started, it was 22. You know, we do not have enough nurses. Nurses are retiring. The beauty of nursing today is the scope of what you can do. You can work in the hospital if that's your passion. You can work on a pediatric floor in the hospital if that's your passion. You can work in surgery, geriatric. You can work at Rolling Hills with psych. You don't have to work in a hospital. You can work for an insurance company. You can work from home and get into informatics. So it is an awesome profession. Not only are nurses retiring, but physicians are retiring. So you've got, just like now you go to the dentist and most of the stuff is done by a hygienist. eventually in the next probably 10, 20 years, you're going to have a whole mid-level, and that's nurse practitioners and PA. So
Can't
the
use
nursing,
initials.
I'm sorry, physician assistant and nurse practitioner. So it's nursing is just an awesome profession to be able to support a family, do what you want to do, and just being able to take care of people. It's great.
And Don, I know that you're constantly got the help wanted sign out for different jobs in our hospital. I don't know how you all keep up with the number of people but we've got great people over there.
Yes, sir, we do. And Lori's point about the nurses, that's absolutely correct. We have seen a greater demand for nurses in this past year. A lot of reasons for that. One of them is the diversity of jobs available to nurses today. But there's other positions in the hospital that you wouldn't think of as being an in-demand job, like informatics. Information technology is huge in healthcare, huge. Hospitals and academic medical centers and others are spending tens of millions of dollars on computer systems to try to meet this population management model, these bundle payments. As easy as those things are to say or describe, very difficult to do, to keep these databases. So there are a lot of other types of jobs if people are interested in healthcare. It's a great place to work. I recommend it to anybody.
So we're about out of time.
Oh.
And as usual, I never get around to everything that I would like to ask, but I always give the opportunity in the last minute or so. What have I overlooked that you would like to say to communicate to our community? We three live here in this town.
Yes, sir.
And you can run into us at any grocery store, in the halls, wherever they are, and so we're accessible. So what do we tell our folks about that I've overlooked?
The one thing I would like to just put one more plug in for the Children's Hospital. We're very busy in the Children's Hospital. We have brought some numbers for you, but we'll have to do that another time. And our Breast Health Center is a great service, and we are seeing lots of patients from Williamson County that would have had to go elsewhere. So I'd like to make a plug for those two services. And we have other services that we're bringing to Williamson County here in the near future.
Lori?
The thing I'd like to end with is I've been there close to 30 years, and what has not changed is we absolutely deliver high quality care, but we care, and that's, I think, what sets us apart. That's what we hear all the time. The nurses, the environmental service, everybody, we care. It's still a community hospital. It's our neighbors and our family that we're giving care to, and it's an awesome place to work and an awesome place to have your care.
Yes.
I think that's what the commercials say now.
Is that what it says?
And I also believe you all believe it, and you walk the talk, and thank you for what you do. Well, it's time to go. I'm Rogers Anderson. Had an enjoyable time talking about our hospital, your hospital, Williamson Medical Center. Hope you don't have to use it, but if you do, you'll get good care. Thank you. Have a good day. I'm Rogers Anderson.